Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to update you again this week on the key COVID developments relevant to dentistry. So firstly, dealing with financial issues. Well, we've continued to demand that the Chancellor extends the financial relief measures that are available to self-employed workers to those earning over more than £50,000 or those operating a private limited company. And we wrote again to the Chancellor at the start of the week and then joined with other professional associations in the healthcare sector representing around 80,000 members to call on the Chancellor to take our concerns seriously, and we'll update you when we've got more. Thank you very much for continuing to support our lobbying efforts in this area. We've today shared the survey results that more than 6,000 of you helped us with, and those results emphasise just how many of you are seriously affected by the current government strategy. And we'll continue to call to pursue the case for support for private dentistry in particular in the area. We also met with HMRC this week to discuss NHS payments during the period of the shutdown, and also raised the difficulties faced by many private dentists and practices at the moment. So we're pleased to say that HMRC confirmed that the NHS payments being passed on to associates at the moment will not impact on self-employment status, whilst the current Treasury support schemes are in place. Elsewhere in the UK, the Scottish Government thankfully clarified that mixed practices can apply for funding for the private element of their income. And this is a huge relief for many dentists and will allow them to carry on planning to how they're going to keep their practices open. We've also called on the GDC to reduce the annual retention fee, and we'll let you know how we get on with that. We know that would really help at this time. So in Northern Ireland, colleagues have been working today, Good Friday, with department colleagues, and have agreed that the department will write again to practitioners to outline how the financial support scheme will work. And we've been assured particularly that individual circumstances are going to be considered fairly. Also in Northern Ireland, we've had confirmation for the department that capitation payments will not be abated, including from the first month of the scheme. So particularly for members, we've got a lot of advice on our financial issues pages on the website. There's a video on furloughed workers. That's available to everybody, but for members particularly, our advice sections have been updated with more questions and answers on staff pay. Secondly, urgent care centres. We've had 2 meetings this week with Health Minister Jo Churchill, and we've got one immediately after the bank holiday weekend, just to emphasise to her how concerned we are about progress in the setting up of urgent care systems within England. And she's in no doubt at all that the profession's concerns on this issue. In other parts of the UK, centres are up and running. In Wales, community dentists are starting to receive patients, and on our website you can read a first-hand account from Northern Ireland dentist Philip McLaughlin on his experiences of working in a care centre in Northern Ireland. Thirdly, personal protective equipment. We're concerned to make sure that all practitioners on the front line have the appropriate PPE and are not put at unacceptable levels of risk. We've been discussing these issues in all 4 countries across the last weeks. At the start of next week, we're expecting an updated guidance on PPE, which will cover all 4 countries. In England in particular, we're expecting an updated standard operating procedure for primary care dentistry, and we hope that that will go some way to addressing some of our concerns in the area. Fourthly, redeployment. Well, new guidance was issued this week dealing with the redeployment of dentists and dental teams working in clinical delivery in the NHS in England. That guidance recognises our position on the redeployment of academics and hospital-based dentists. It also clarifies that there'll be further guidance dealing with how we pay for dentists and their teams coming out of primary care settings. So look out for that in due course. So that's it from me this week. Just to end on a positive note, we've published recently a great blog that highlights some of the fantastic things that dentists around the UK are doing to continue to help their patients, their communities and frontline healthcare workers. So do please give it a read, and I hope you have a safe and happy Easter, and we'll be back next week to update you again. Thank you.